In terms of overall cases of COVID-19 and deaths related to the virus, Oregon has done relatively well compared to other states, but that doesn't mean the state's response has been without its problems.
Fox's Simon Gutierrez sat down with a global public health expert from Oregon State University to take stock of how our state has done so far and the opportunities that have been missed.
We spoke with Chunwei Chi, the director of OSU's Center for Global Health. He says despite some successes in controlling the spread of the virus, Oregon missed a key opportunity early in the pandemic when there were only a couple dozen new cases per day.
Could you share some of the recommendations you had that weren't followed?
One thing we neglected and were not able to implement is strict isolation and quarantine of those who are exposed or infected. The people who are spreading this virus generally have no symptom. We don't know who they are. And if we don't know who they are, how can we contain that? It requires strict quarantine and isolation. And that's the key to success. And this strict quarantine and isolation require logistics, require infrastructure. And it can be done when your daily new cases, like Oregon, is below 100. That's manageable. When it's several hundred, 2,000, we don't have that capacity.
Do you see other countries around the world doing a better job?
I think of all the countries that are doing the best is Taiwan. And Taiwan so far is probably the only country that never locked down. One of the strategies they did well was the massive distribution of masks from the beginning. Taiwan did the right choice of using masks as a first line of protection because by May and June, there's a strong evidence that the virus is airborne.
Oregon, by comparison, didn't require the wearing of face masks in public until late July. By that time, the virus was already considered to be widespread throughout the state, with nearly 300 new cases per day. I'm Simon Gutierrez, Fox 12 Oregon.